What if that dark patch on your neck isn't a tan, but a warning sign that your blood sugar is spiraling out of control? Tiny skin tags that seem to multiply over time. Breakouts along your jawline, even though you're not a teenager anymore. Or skin that feels oilier than it used to. Most people treat these as cosmetic problems. They try new creams, new cleansers, new serums. But what if your skin isn't the problem? What if it's the messenger? Your skin is one of the most hormonally sensitive organs in your body. And when certain hormones are out of balance, especially insulin, your skin is often one of the first places it shows up. Now, let's be clear. Not every skin issue is related to insulin, but some very specific patterns are strongly linked to chronically elevated insulin levels and insulin resistance. And here's why that matters. High insulin doesn't just affect blood sugar, it influences inflammation, oil production, cell growth, pigmentation, and even wound healing. In other words, it can change how your skin looks and behaves. The powerful part? These skin changes often appear years before a diabetes diagnosis. Today, we're going to break down what your skin may be trying to tell you about your insulin levels, the most common warning signs, why they happen, and what you can do about them. Because once you understand the signal, you can address the root cause, not just the surface. Let's start with the most recognizable sign. Sign number 1. Dark, velvety patches on the neck or armpits. Acanthosis nigricans. If you've ever noticed a dark patch on the back of your neck that doesn't wash off, this is important. Many people assume it's dirt, poor hygiene, sun exposure, or simple pigmentation. But if the skin feels thicker, slightly raised, and velvety, especially around the neck, armpits, groin, or under the breasts, it may be something called Acanthosis nigricans. And this is one of the strongest visible signs of insulin resistance. What it looks like: darkened skin, brown, gray, or black tone depending on skin color. Velvety or soft, thickened texture. Often appears symmetrically, most common on the back of the neck. It's not usually painful, it doesn't itch, but it often slowly becomes more noticeable over time. Why high insulin causes it. Here's what's happening under the surface. When insulin levels stay chronically elevated, excess insulin doesn't just circulate in the bloodstream. It also binds to growth receptors in the skin. High insulin stimulates increased skin cell production, increased pigment production, thickening of certain skin areas. Over time, this creates that darker, thicker patch. This isn't a surface problem, it's a hormonal signal. Who is most likely to notice it? Acanthosis nigricans is more common in people who have insulin resistance, have prediabetes or type 2 diabetes, have PCOS, carry excess weight, especially around the abdomen, have a family history of diabetes. It can appear in adults, but sometimes even in teenagers who are developing insulin resistance early. Why it matters. On its own, this condition isn't dangerous, but it's often an early warning sign. Many people develop these patches years before abnormal lab tests. That's what makes it powerful. It's visible. Your skin is showing you what your blood work may not yet. Can it improve? Yes, as insulin levels decrease and insulin sensitivity improves, these patches often become lighter, become thinner, stop spreading. It doesn't happen overnight. Skin changes take time, sometimes months, but improvement is possible when the underlying insulin issue is addressed. Important note: not every dark patch is insulin related. If a patch appears suddenly, spreads rapidly, or looks unusual, it should be evaluated by a healthcare professional. But if it fits this pattern, especially alongside other metabolic symptoms, it's worth paying attention. Because this isn't a cosmetic issue, it's a metabolic message. And the next sign is much smaller, but just as revealing. Sign number 2, skin tags that keep appearing. They're small, soft, often harmless. But if you've noticed multiple skin tags developing over time, especially around your neck, armpits, eyelids, or under the breasts, your skin may be signaling something deeper. Skin tags, medically called acrocordons, are tiny, flesh-colored growths that hang off the skin. Many people ignore them because they're painless and common. But here's what's interesting. People with insulin resistance tend to have more of them, and they tend to cluster in certain areas. What they look like: small, soft, flesh-colored bumps, attached by a thin stalk, common in skin folds, often increase gradually over time. One skin tag alone means very little, but multiple skin tags, especially combined with other signs like dark neck patches or stubborn weight gain, can form a pattern. The insulin connection. When insulin levels are chronically elevated, insulin doesn't just regulate blood sugar, it also acts like a growth signal. High insulin stimulates cell proliferation, tissue growth, increased activity in skin growth pathways. Over time, this can contribute to the development of skin tags. Studies have found higher rates of insulin resistance in individuals with multiple skin tags compared to those without them. This doesn't mean every skin tag equals diabetes, but frequent or increasing skin tags may reflect underlying metabolic stress. Why they often appear in folds. Skin tags commonly develop in areas where there is friction. Skin folds trap moisture. Insulin receptors are active. Combine friction plus elevated insulin plus growth signaling, and small growths can form. That's why they often appear in clusters around the neck and armpits. Should you be concerned? Skin tags themselves are benign. They don't become cancerous, they're not dangerous, but cosmetically removing them without addressing insulin levels may mean they continue appearing. If you notice multiple skin tags, increasing frequency, combined with dark neck patches, plus fatigue, cravings, or weight gain, it may be worth checking your metabolic health. Can they go away? Existing skin tags usually don't shrink on their own, but when insulin sensitivity improves, new ones often stop forming. That's the key. Your goal isn't just removal, it's reducing the internal trigger. Your skin is giving subtle clues. The next sign, however, is much louder and often emotionally frustrating. Let's talk about persistent adult acne. Sign number 3, persistent adult acne, especially along the jawline. Acne is often dismissed as a teenage problem. But if you're dealing with breakouts in your 20s, 30s, 40s, or beyond, especially deep, painful acne along the jawline or chin, insulin may be part of the picture. Many adults try expensive skincare routines, prescription creams, antibiotics, hormonal treatments, and yet the acne keeps coming back. That's because in many cases, the trigger isn't just on the surface. It's hormonal. The insulin-androgen connection. Here's what happens internally. When insulin levels are chronically elevated, insulin stimulates the production of androgens, male pattern hormones present in both men and women. Higher androgens lead to increased oil, sebum production, thickening of skin cells inside pores, more inflammation. Oil plus clogged pores plus inflammation equals acne. This is why insulin-driven acne often feels deep, cystic, persistent, resistant to topical treatment. Why the jawline? Adult hormonal acne commonly appears along the jawline, on the chin, around the lower cheeks. That distribution pattern is strongly linked to hormonal fluctuations, especially insulin and androgen activity. If acne worsens with high sugar intake, processed carbs, frequent snacking, poor sleep, that's another clue insulin may be involved. Common in PCOS and insulin resistance. Persistent adult acne is especially common in women with PCOS, individuals with insulin resistance, people with irregular menstrual cycles, those experiencing weight gain plus cravings. In these cases, treating the skin alone often isn't enough. Why creams sometimes don't work. Topical treatments address bacteria and inflammation. But if insulin and androgens remain elevated, oil production continues. That's why some people see temporary improvement, but breakouts return. The root cause hasn't changed. What happens when insulin improves? When insulin levels stabilize, oil production often decreases. Breakouts become less frequent, inflammation improves, Skin texture evens out. This doesn't happen overnight. Skin turnover cycles take weeks. But many people notice clearer skin once metabolic health improves. The bigger pattern. If adult acne is paired with skin tags, dark neck patches, irregular cycles, abdominal weight gain, it strengthens the insulin resistance pattern. Your skin isn't just breaking out, it may be signaling hormonal imbalance. And the next sign is subtle but deeply connected to insulin's effect on growth signals. Sign number 4. Excess facial or body hair, especially in women. This one is more sensitive but extremely important. If you've noticed increasing hair growth in areas like chin, upper lip, sideburn area, chest, lower abdomen, especially if it feels thicker or darker than before, insulin may be playing a role. This pattern is called hirsutism, and it's often linked to hormonal imbalance, particularly elevated androgens. And insulin has a direct influence on that process. The insulin-androgen link. When insulin levels remain chronically elevated, insulin stimulates the ovaries in women to produce more androgens, male pattern hormones that are present in both sexes. Higher androgen levels can lead to increased facial or body hair, thinning hair on the scalp, oily skin, persistent acne. This is why excess hair growth is commonly seen in women with insulin resistance, PCOS, polycystic ovary syndrome. Irregular menstrual cycles, weight gain centered around the abdomen. Insulin doesn't just regulate blood sugar, it also influences reproductive hormone balance. Why this is often missed. Many women treat the symptom, waxing, tweezing, laser treatments, but if insulin remains elevated, androgen production may continue. This isn't a cosmetic issue at its root, it's a metabolic one. Other clues that strengthen the pattern. Excess facial hair combined with jawline acne, irregular or missed periods, difficulty losing weight, dark neck patches, skin tags. Strong insulin resistance may be involved. One sign alone doesn't confirm anything, but patterns matter. Can it improve? Yes, but gradually. When insulin sensitivity improves, androgen levels often decrease. Hair growth slows, acne improves, cycles may regulate. However, existing hair may require cosmetic treatment, while new growth often slows once hormones rebalance. Important note: not all excess hair growth is caused by insulin. Genetics and other endocrine conditions can also play a role. If hair growth is sudden, severe, or rapidly worsening, medical evaluation is important. But if it developed gradually alongside other metabolic signs, insulin resistance is worth investigating. Your skin and hair are responding to internal hormone signals. And the next sign is less obvious, but just as telling: changes in oil production and pore size. Sign number 5. Oily skin and enlarged pores. Some people have naturally oily skin. That alone doesn't mean anything is wrong, but if your skin has become noticeably oilier over time, especially alongside acne, weight gain, or other metabolic symptoms, insulin may be part of the story. This is one of the more subtle signs, but when combined with others, it becomes meaningful. The hormone chain reaction. Here's what's happening internally. Chronically elevated insulin increases levels of insulin-like growth factor 1, IGF-1, and stimulates androgen production. Both IGF-1 and androgens increase sebaceous gland activity, increase oil, sebum production, thicken the lining of pores, increase inflammation. More oil plus thicker pores equals shinier skin and enlarged-looking pores. Over time, this can also contribute to blackheads and breakouts. Why diet can influence oil production. High glycemic foods, especially refined carbohydrates and sugar, cause rapid spikes in insulin. Repeated insulin spikes can increase sebum production, inflammatory signaling, hormonal fluctuations. Some people notice their skin becomes oilier when they consume sugary snacks, sweetened beverages, white bread or pasta, large carb-heavy meals. That's not a coincidence. it's a hormonal response. How this differs from normal, oily skin. Genetic oily skin tends to be consistent throughout life. Hormone-driven oiliness often worsens in adulthood, appears alongside acne, fluctuates with diet, improves when carb intake is reduced. If your skin became oilier after weight gain, increased sugar intake, or lifestyle changes, insulin may be contributing. Can it improve? Yes, when insulin levels stabilize, sebaceous gland activity often decreases. Shine becomes more manageable. Breakouts reduce. Skin texture may improve. But like all hormone-driven changes, this takes time, often several weeks to months of consistent metabolic improvement. The pattern to watch for. Oily skin alone doesn't diagnose insulin resistance, but oily skin plus acne plus skin tags plus dark neck patches plus abdominal weight gain? That's a pattern, and patterns are powerful clues. Now let's talk about a sign that goes beyond appearance and can signal more advanced metabolic dysfunction, slow wound healing, and frequent skin infections. Sign number 6, slow wound healing and frequent skin infections. This sign is less cosmetic and more clinical. If you've noticed, cuts or scrapes taking longer than usual to heal. Small wounds that linger for weeks. Frequent fungal infections, especially in skin folds. Recurring yeast infections. Persistent athlete's foot. Your skin may be signaling impaired glucose regulation. Why insulin and blood sugar affect healing. Healthy wound healing requires stable blood sugar, proper circulation, strong immune response, controlled inflammation. When blood sugar remains elevated, often due to insulin resistance, several things happen. Immune function weakens. High glucose levels impair white blood cell performance. Circulation becomes less efficient. Chronically high insulin and glucose can damage blood vessels over time. Inflammation increases. Persistent low-grade inflammation interferes with tissue repair. Bacteria and fungi thrive. Elevated glucose creates a more favorable environment for microbial growth. This is why recurrent skin infections are often one of the earliest complications in people with poorly controlled diabetes. The early warning phase. In advanced diabetes, delayed wound healing is well known, but in early insulin resistance, it can show up subtly. A paper cut that lingers, acne lesions that scar easily, bug bites that take longer to fade, recurrent rashes under breasts or in the groin area. These may not seem dramatic, but when combined with other signs, they matter. Why this sign shouldn't be ignored. Skin is highly vascular. If healing is impaired here, it may reflect deeper metabolic stress. It doesn't mean severe damage has occurred, but it does mean glucose regulation may need attention. Important distinction. Many things can impair healing, including nutrient deficiencies, thyroid disorders, smoking, autoimmune conditions. But if slow healing appears alongside dark neck patches, skin tags, abdominal weight gain, fatigue after meals, increased thirst, it strengthens the case for evaluating insulin and blood sugar. The bigger picture, skin as a metabolic mirror. Your skin isn't random. It responds to hormones, blood sugar, inflammation, circulation, nutrient status. Insulin sits at the center of many of those systems. Not every skin issue equals insulin resistance, but clusters of signs often point in one direction. The key isn't panic, it's pattern recognition. If several of these signs resonate with you, the next step isn't guessing, it's testing. Fasting glucose, fasting insulin, HbA1c, possibly an oral glucose tolerance test. Because what your skin is trying to tell you is this: metabolic imbalance often whispers before it shouts, and the earlier you listen, the easier it is to course correct. Final takeaway plus action steps. Your skin is more than just a protective layer, it's a messenger. The dark patches on your neck, the tiny skin tags, persistent jawline acne, excess facial hair, oily skin, And even slow-healing wounds aren't random. They are signals your body sends when insulin is running high and your metabolism is under stress. Recognizing these patterns early can give you a head start on improving your health before more serious issues arise. Action steps to start today. Check for patterns, not single signs. Look in the mirror for multiple signals. Dark patches, skin tags, oily skin, acne or hair changes. Get tested. Consider fasting glucose, A1C, and fasting insulin. Knowledge is power. Adjust lifestyle to improve insulin sensitivity. Focus on protein-rich meals, high-fiber vegetables, healthy fats, limiting refined carbs and sugar, consistent sleep and stress management. Track progress, take photos or note changes over weeks. Skin improvements reflect deeper metabolic changes. Consult your healthcare provider if multiple signs persist or if you notice sudden changes. Early intervention matters. Your skin speaks. Listen carefully. Even small, consistent changes in diet, activity, and sleep can have measurable effects on both your skin and your overall health. If this video helped you recognize patterns in your skin, drop a comment sharing which sign surprised you the most, and subscribe for more science-backed strategies to lower insulin naturally, improve blood sugar, and feel your best. Thank you for watching this plausible video.